That other model we mentioned, it's a draft federal government model based on preliminary data, and it warns of dire consequences if reopening is not done with proper care. The scenario planning information, as it's known, is based on research developed by Johns Hopkins, and it says average daily death toll from this virus could nearly double to 3,000 by June 1st. President Trump has been publicly encouraging states to reopen, of course. Paula Reed is at the White House for us. Paula, good morning. What is the president saying about all this?
Good morning, Tony. In an interview last night with the New York Post, the president said he's never seen this document. But the researchers who did this analysis say their data was preliminary and it wasn't supposed to be used to make predictions. But they do concede that there are some scenarios, especially if social distancing is eased too soon, that could result in a significant increase in the number of people who die from coronavirus.
An alarming new report in the New York Times today reveals that behind the scenes, Trump's own administration is predicting that coronavirus will imminently take a disastrous turn for the worse. The daily death rate will soon nearly double, approaching 3,000 deaths a day in the U.S. by June 1st. That's less than a month away. And that's not all. The New York Times writes this, quote, the projections based on government modeling pulled together in chart form by the Federal Emergency Management Agency forecast about 200,000 new cases each day. By the end of the month, that's up from 25,000 cases now. The numbers underscore a sobering reality. While the U.S. has been hunkered down for the past 7 weeks, not much has changed, and the reopening to the economy will make matters worse.
Much of America is starting to reopen right now this week. 32 states offering at least partial ways for people to return to life and work. Ground zero for all.
Dr. Cass, it's Willie Geist. Thanks for being on this morning, and thanks for all you've done, the sacrifices you've made. As Mika mentioned, you contracted coronavirus, and you are back in now the emergency room working after your recovery. Can you just talk a little bit about how you contracted it, what it was like for you to have it, and what it's like now to go back, and just a snapshot of what it's like in a New York City emergency room right now? We talked, a month and a half ago about the chaos and the lack of PPE and the hospitals being swamped in some regards. What's it like now?
So I think first, I don't know exactly how I got the coronavirus. I was a New Yorker, so I live and work in New York, and so I could have gotten it anywhere the community spread, but most likely got it at work in the emergency department, probably honestly from touching a surface and then touching my face inadvertently. I think we forget how easy it is to contract the coronavirus from a surface alone, and that's why we do encourage masks even outside on a regular basis.